Hello, fellow Healthcare Administration students for Healthcare 375. This is Group 3's presentation on long-term care facilities. So first, let's start out by defining what long-term care is. It's the regular assistance for people with chronic illnesses or mental or physical disabilities. And so they're primarily intended to help people with activities of daily living, like eating, bathing, dressing, taking medication, or toileting. And so the history of long-term care kind of goes back to the 12th and 15th centuries. Long-term care didn't start to really get administered by the government until 1493, when these facilities were starting to be established through monasteries, and the Catholic Church at the time was basically run jointly with the government. And so they were administered jointly by the king and a local bishop. And it was believed that they served as some sort of training ground for the Catholic Church. And so in 1536, King Henry VIII had a dispute with the Catholic Church, which closed down all the monasteries and their long-term care facilities. And then 1546, he appointed a board of local citizens to oversee the management of long-term care facilities. Then in 1601, Queen Elizabeth changed it up a little bit by having the community care for their elderly as long as possible before admitting them into a long-term care facility. And then in 1722, England enacted the Poor Law, which is basically the equivalent to today's Medicaid. And so when America was founded, they kind of took these traditions with them. And so these long-term care facilities were established in Philadelphia, New York City, and Charleston around the 1720s and 30s. So the thing is that the welfare system of the time was administered locally and didn't become a federal obligation until around the 20th century when America became industrialized. And this put pressure on, the communities to establish more long-term care facilities because people were working more and they didn't have kids to take care of them. So in the attempt to rescue the elderly that were heavily affected by the Great Depression, that didn't have savings to take care of themselves as they got older, the Social Security Act of 1935 was passed, which basically provided benefits to the elderly and the disabled. So in the 1950s, federal legislation offered pretty attractive subsidies to people who would erect a nursing home, and so they became pretty popular around that time. It was, however, a pretty unregulated industry and called for some reform, and so in the 1960s, Congress met to begin to come up with some different laws and acts that would protect elderly people. So in our presentation, we've included a couple of laws that have been passed to help keep patients safer. In 1967, there were amendments made to the Social Security Act, which required nursing home administrators to be licensed to be more qualified to administer at nursing homes. Then in 1978, there were amendments made to the Older Americans Act, which required all states to develop an ombudsman program. So what I didn't know is that an ombudsman is basically an official appointed to investigate any maladministration claims. Then in 1980, there was the Mental Health System Act, which basically provided federal funding to mental health programs. Then in 1982, under the Tax Equity and Fiscal Responsibility Act, it protected children that were eligible for Medicaid to receive care. Then in 1988, there was the Medicare Catastrophic Act, which was pretty short-lived as it was repealed in 1989. And then in 1990, there was the Over 90, which is basically an expansion of Medicare to cover hospitalization services in community and mental health centers. Then there's Americans with Disabilities Act, which basically worked to end segregation between people with disabilities and the community. In 1993, the Clinton Healthcare Plan expanded home and community-based services to improve Medicaid and the coverage of institutional care. Then in 2000, the Americans Act Caregiver Program authorized grants to people and their informal caregivers to care for the loved ones at home. Then in 2001, the New Freedom Initiative was basically an act to take down barriers between the community and people with long-term disabilities. Then in 2010, the Affordable Care Act was enacted, which basically expanded Medicare and Medicaid, which caused more funds to be available to long-term care programs. So one of the main focuses of this module in long-term care was the Great Society legislation of 1965, which we know it as the Older Americans Act. There are 7 different titles that we'll go over really quick. So Title 1 is the Declaration of Objectives, which outlines the act itself. Then Title 2 is the establishment of the Administration of Aging, which outlines its responsibility in administering long-term services and supports. Then Title III is grants for state and community programs on aging, which basically authorizes funds for any type of family caregiver support, disease prevention, and health promotion activities. Title IV is the Activities for Health, Independence, and Longevity, which basically supports a wide range of projects related to income, health, housing, and long-term care. Then Title V is the Community Service Senior Opportunities Act, which basically helps anybody over the age of 55 with poor employment opportunities to find a job. Then Title VI includes grants for services for Native Americans. It's pretty self-explanatory. It rewards grants to fund supportive services to Native Americans. Title VII, the Vulnerable Elder Rights Protection Activities, that authorizes the Ombudsman Program to investigate and resolve any complaints of the residents of a long-term care facility. Then in 2016, the Older Americans Act was reauthorized. It was completely approved at the House and passed by the Senate, and then was signed into law by President Barack Obama. The main purpose behind the reauthorization was to create new support for modernizing multipurpose senior centers, and also to address economic needs. And it also required that health promotion and disease prevention initiatives to be evidence-based. It also promoted chronic disease self-management and fall prevention. The advocacy group that represents long-term care is the National Council on Aging. It helps seniors with Medicare and Medicaid enrollment. It also helps with Part D prescription enrollment. It connects low-income seniors to benefits that fight hunger. It also helps identify underserved individuals in the area that might be eligible for benefits that are not enrolled. All right, now let's talk about the requirements for long-term care facilities. In order for them to receive any type of government reimbursement, they need to be CMS certified. And so there's a rule of thumb that if a long-term care facility is not CMS certified, then it should probably be avoided, since CMS compliance is the lowest level of certification. Then in order to maintain its certification, there's an annual survey completed by the state to see if it is upholding to the standards of CMS. So there are a couple different types of long-term care facilities. There are assisted living facilities, continued care, retirement facilities, nursing homes, and home care. And we'll just explain each of these really quick. So first we have assisted living facilities. They're different from a nursing home because the residents do not require like around-the-clock monitoring. They basically provide support services to people to help them with activities of daily living, like taking their medication or meals. The next we have nursing homes. So nursing homes have to be licensed through the state that they're based in, and they deliver high levels of care for individuals that require constant monitoring. So there are about 3 different levels of care delivered in a nursing home. First, there's intermediate care, which provides up to 8 hours of nursing care per day. Then there's skilled nursing, which offers 24 hours of care to those with serious deficiencies. And then skilled nursing for specific disabilities is basically 24 hours of care for those with chronic conditions or illnesses. And it can also be referred to as custodial care. Then there are continuing care retirement facilities, which is basically a multi-level care facility that includes assisted living, skilled nursing, and nursing home services all together. This allows a resident to transition from assisted living to a nursing home as their mental and physical needs change over time. So last, there's home care, and it basically offers the same benefits from a skilled nursing facility, but it's delivered to an individual's home. This type of care can be temporary for a patient recovering from an illness or injury. It can also be permanent to assist a patient in all levels of long-term care. All right, funding sources. So if you take a look here, we can see that Medicaid is the dominant source of funding for long-term care. Then we have a small portion of other private insurance, which is probably because in the 1990s, long-term care insurance increased significantly. But then we have a big portion here of out-of-pocket payers, which, if we can remember from our healthcare insurance industry class, a lot of long-term care is paid for out of pocket. All right, now let's go over the managerial challenges of long-term care facilities. According to a study done in New Zealand involving 45 different long-term care managers, they all had a couple of things to say that were in common. First, most long-term care managers are middle-aged women with nursing qualifications but lack management qualifications. Second, there's a high turnover rate for registered nurses and employees, which makes things difficult when you have to keep retraining people. Then the most prominent issue that managers faced was inadequate funding to match the growing costs of providing long-term care, and they believed that political, regulatory, economic, and social factors influenced these issues. We really hope that you guys were able to learn a lot about long-term care through our presentation. Here are our sources. If you have any questions, be sure to post them on the discussion board. Thank you so much for watching.